We have some health news for you. A recent study found more women are drinking themselves to death now, and alcohol is more common among women than men. Previous studies have shown that women tend to drink more. I spoke to a cardiologist to find out about the effects of alcohol on your health and how much is too much. Joining me now is cardiologist Dr. Fahmi Farah. Good to have you back on the show. Now let's talk about the new study that shows that alcohol deaths are on the rise when it comes to women. So why do you think that's the case?
There are several factors involved. Alcohol in general can cause a lot of damaging effects to the heart. And, one of them is heart failure. Excessive consumption of alcohol can weaken the heart muscle. And there's something called cardiomyopathy, which is a form of heart failure. And that can cause essentially the pump of the heart doesn't work as efficiently. So the heart fails. And that in turn can increase the mortality. In women, like we are seeing an increased rate of death as a result of alcohol consumption, probably due to the increased rate of alcohol consumption and the various side effects related to that.
Now, how much do those women drink that death is a result? As in, are we talking about severe alcoholism?
Not necessarily. So the impact of alcohol can vary from individual to individual. Of course, excessive alcohol consumption can impact anyone, and they don't necessarily have to have a genetic predisposition. However, there are groups of people where they don't have to have a ton of alcohol. Just moderate degree alcohol consumption can lead to damage to their organ system, especially the heart.
Now, before death actually comes into play, what are some other symptoms of excessive drinking before that can be warning signs?
So excessive drinking alcohol symptoms usually come from the damage it causes to some of the organ system. So let's start with the heart. So one of the common things that happens with alcohol is rhythm problems. So people can have palpitations, shortness of breath, anxiety, feelings of anxiety as a result of the heart rate going high and having arrhythmia, but also heart failure. As I was explaining earlier, they can have swelling in their legs, shortness of breath, just fatigue in general. They'll see skin differences as well. They will see, something called spider veins that'll start popping up in different areas of their skin. The liver is one of the other organs that's affected by alcohol, so they can start seeing jaundice of their skin, which is yellowing of the skin. That's usually in higher level liver damage due to alcohol. So it can really range from just having shortness of breath, swelling, and palpitations, all the way to jaundice, having liver failure. So the scale is wide.
Now, is there a rule of thumb of how frequently people can have that glass of wine and still be healthy?
That is a tough question to answer. In the past, we used to say one alcoholic beverage a day for women and men. But in the recent past, in the last couple of years, we have had studies that came out and showed that no amount of alcohol is good for the heart. And so on that note, I would say abstinence is best. But that being said, every once in a while, everybody, people do want to enjoy a glass of wine. And I don't think there's anything wrong with that. So moderation is key.
Interesting points. Thank you so much, Dr. Fahmi Farah. I really appreciate your insights.
Thanks for having me.